Welcome to this edition of ISR Spotlight, recorded on International Women's Day. Today we're going to be talking about whether suicide research has an ethno-racial diversity problem, and if so, how we can all take steps to address this. So I'm here today with a brilliant woman in science on International Women's Day, Dr. Diana Clarke. Diana is the Director of Research and Senior Statistician and Epidemiologist at the American Psychiatric Association, an Adjunct Assistant Professor at the Department of Mental Health, Johns Hopkins Bloomberg School of Public Health. And she's also an ISR board member. Diana graduated with her PhD from the University of Toronto in 2006, investigating ethnic differences in the pathways to suicide and suicidal behaviors. She then went on to complete a postdoc in psychiatric epidemiology within the Department of Mental Health at Johns Hopkins. Diana has dedicated herself to diagnostic accuracy, including cultural sensitivity in the assessment and treatment of mental health disorders, with a special focus on suicide prevention. And she's also actively engaged in work to strengthen and diversify the clinician scientist workforce. Diana, welcome. Happy International Women's Day.
Thank you. Same to you. Thank you.
So thank you so much for joining us then for this edition of ISR Spotlight. And so we're going to be talking then about ethno-racial diversity in suicide research. And so I just want to start off by asking you, what's the general picture then in terms of ethno-racial diversity in suicide research, both in terms of the people who we're including in our studies then as participants, but also as well about the people who are conducting the research, so the researchers themselves.
Okay. Thanks for doing this, Olivia. This is a very, very important and interesting topic. And so research studies, you do have research studies on suicide and suicide behavior that includes an examination of ethno-racial differences. But typically when these research, when they're done, these variables are often included because, they need to have a diverse patient population or, sample. Or when they do examine ethno-racial differences, it's not necessarily looking at ethno-racial differences, but they include ethnicity and race, but they tend to treat it as a nuisance variable, right? So they adjust it away, which is unfortunate because it's adjusted away so you don't get to actually dig deep and understand what's going on. And another thing too, when race and ethnicity, when they're included in research studies, researchers sometimes fail to think about, well, why am I including race and ethnicity? What's a theoretical framework as to why I'm including this? And then letting that theoretical framework guide the analyses. Majority of the time, it's actually looked at, as I said, as a confounder. And I've heard researchers say, well, I'm an epidemiologist and I was trained to do it this way. I was trained at University of Toronto as an epidemiologist. And I remember clearly in those epidemiology classes being told that when you're looking at any variable that you think might be a confounder, something that you need to adjust for, you really and truly need to take a step back, look at it first. Is this really a confounder, something for me to just adjust away? Or is it an effect modifier? Is it something that is really important for me to probably stratify and look at more deeply? And so in the research that I do, I really try to think about it that way. Is it a mediator or a moderator? So I try to think about those things before I tend to adjust for things. So that's something that I think more and more researchers need to think about. So I think that's one of the things that's missing, that researchers are putting and they're including race and ethnicity in their research, but not necessarily thinking about the why. Mm-hmm. That said, it's still limited. There's a lot of research that's been done where it just doesn't have enough sample of people of other race and ethnicity, right? So it's most of the time predominantly white. And then you'll have smaller numbers of the other ethno-racial groups, which is unfortunate because when your sample of those groups are too small, then you can't really say anything. Right? Because you don't have the analysis. You can't really do the analysis. The power is just not there for you to do that. So that's unfortunate. And then I think, so it's a sampling, so sampling strategies need to change. So if you really and truly want to examine something and to be able to truly analyze it and look at something related to race and ethnicity, then you need to make sure that your sample is large enough. So sampling strategy, probably need to do more, some stratified or some clustering sample so that you get larger numbers. That said, there's also a lot of issues going on where a lot of, so I would say African-American Blacks, probably they don't necessarily trust the research or the healthcare system well enough to then participate in these research. So recruiting them into research studies can be challenging, but because it's challenging doesn't necessarily mean that you shouldn't do it. So, so there's that. So there's quite a few factors, right? And then also I do believe that, which is part of the work that I'm dedicated to, is to kind of strengthen and diversify the clinician scientist workforce. And it's the scientist workforce in general, but as my work at the APA, I'm focusing on educating and enriching the physician scientist workforce as it relates to psychiatrists. But, and the reason for that is because I do believe that clinicians bring a unique perspective to looking at different mental health issues. They deal with clients who are experiencing these situations, and so they come into it with a different lens. So I think it's important, but I also think it's important to diversify the general science workforce that's actually looking at these issues. Because I think when you come into this research and you have a minority status, or you have a Black person, then you might be better able to recruit people to participate in your study. But not only that, the lens with which you approach your research study is going to be different. Your research questions will be different. And so I think it's a combination of all those things. And you do have African-American Blacks participating in research around suicide and suicide behavior and other mental health issues. I just think the research that they tend to be a bit different. So they're more focused on, the methodology that might be used might be different. So most of these funding agency might actually focus on quantitative research. And then you might find that some research are being done that try to get at the heart of things. So it's more qualitative in nature. Doesn't mean that they're less meaningful. They're as meaningful. And so I think it's a combination of, it's limited in terms of how ethnicity and race, how they're looked at when they're included in research. It's limited in the sense that you don't have a diverse enough population research in this. So we need more Black researchers coming to the table and doing this research and being engaged and being encouraged and mentored to continue along that track. And then also, we need to change our methodology. The focus on quantitative research, we need to modify those things so we can actually collect the information that will really allow us to understand what's going on in the Black community and different ethno-racial groups, so not just Black.
Yeah, and with qualitative research, that's an interesting point as well, because suicide research perhaps has a slightly checkered history, shall we say, in terms of accepting qualitative research, and there's been some kind of notable discussions about that before, in terms of whether qualitative research is seen as the sort of poor relation of quantitative research. So maybe that's also that more general sort of view by some researchers of qualitative research is perhaps also a mechanism through which people are then excluded from bringing out their research and sharing those messages then as well, perhaps.
Yeah, I would agree. And I think, I don't think quantitative research by itself gives us a full picture, and qualitative research by itself don't give us a full picture. So it's the coming together of these two that's going to be important for us to get at these things. And it's related to suicide, but it's related to understanding mental illness, period. Sure. I think we need to use more mixed methods in what we do.
Mm-hmm. Yeah. No, I think that's a really excellent point.